Okay, now where do we leave off here? So now, being that we scroll through the menu, once again, just as a reminder, those were just patient menus. The patients have access to. Obviously, patients are not going to be able to change their parameters within their modes, their ventilation parameters. So there is a secret handshake, as typical as home equipment typically does have, to get into a clinical or provider menu. Now, this can be done with the ventilator running, and typically to change other or all the parameters, the ventilator should be off prior to, which I will turn off now. As you can see, it's prompting me also power off, and I want to make sure that yes, you do want to turn off the ventilator. Now, the secret handshake for the Trilogy is the highest and lowest button. That's how I always remember it. So it will be the arrow down button and the alarm silence button. If you press these together, keep them pressed for a few seconds, and the ventilator will beep twice. And now you could actually see you're in a setup menu. So now you have the ability to go in to the different type settings, whether it's the primary settings or the secondary settings, and change any of those parameters or change the mode, complete mode. Let's go to primary settings right now. As you can see, I just pressed the down button. I highlighted primary settings and hit select. Now we have the current primary settings. Dual prescription, that'll always show. You can turn that off in this, but just by simply hitting modify and turn it off. So now you're not going to have that ability to toggle between the two different modes that are currently on. Most patients that we do see at home will have the dual prescription mode turned on. Not all, but most will. So that's going to be up to how the patient comes in and what their current settings are. In this case, we're going to leave this mode on. So you're going to hit OK, and that'll take me to mode now. Now to change a mode, you're in AVAPS AE. If, let's say, for instance, a pulmonologist wanted to place the patient, is not happy with AVAPS AE, wants to place them at SIMV pressure support. Just hit modify and scroll. You could scroll up or down. And you could see here through all the modes, pressure control, there is just a timed mode, spontaneous time mode, spontaneous mode. There, yes, this ventilator does do just CPAP. There's your SIMV mode, assist control mode, control volume mode, pressure control SIMV mode. So you could see that it basically this ventilator has a capability of a critical care ICU ventilator. It has all those modes. Let's say, for instance, here we'd like to do pressure control SIMV. We would just hit yes. And now it's on here, and now you'll scroll through your different settings: inspiratory pressure, 20, your PEEP, pressure support above PEEP, and so on, breath rate, inspiratory time. And to change any of these features, you could just go inspiratory time. The patient needs a little longer inspiratory time. You just gotta go ahead and highlight it. As you can see, once it's highlighted with the box, you could change it by the up and down arrows. Then to set it, just hit OK. And that's set. Let's go back and change the ventilator mode back to AVAPS AE, because the patient is doing well on that. So of course, we would hit modify and AVAPS AE. So now you're back to AVAPS AE. In this case, though, the doctor does want to come down the tidal volumes. He thinks they're a little high. You would scroll, like I said, modify, and come down to 200. And that's how you would change any settings or modes in the Trilogy 100, 200, or 202 ventilators. Of course, to finish off, you always want to make sure that you follow all the way through the prompts. So you hit finish, and activate AVAPS AE mode will come up, and you always hit yes. So never walk away unless you've hit all the buttons, including exit. Now, because we entered the provider menu with the ventilator off, it is going to go off. But once we turn it on, we'll go back on AVAPS AE mode. And for instance, as you can see, just here, there's an alarm and a message. Now, there are different types of alarms. There's critical alarms and non-critical. Typically, you're going to see this is just a notification. If it's a non-critical alarm, something can be batteries are starting to run a little bit low, but it's just warning you. It'll be a yellow message. Now, if battery or so is a critical level, or let's say, for instance, the patient is apneic or things like that, or a disconnect alarm, you're going to see a red bar is going to come across here with the alarm. That's going to be more of a critical alarm. So that's a little bit about what to look for when the alarms go off. Of course, this one's just a notification. I'm going to reset that. And now to get in, you can also access the provider menu with the ventilator on. The same procedure. Silence button and the load the down arrow button. And as you can see now, you're in and you're able to switch to secondary settings, primary settings and alarm, and secondary settings and alarms. For instance, in this case, the patient is on AVAPS AE, but secondary settings, the physician may want to start weaning the patient. Maybe just a CPAP during the day. What you could do is place this mode into modify. Let's go to CPAP. And CPAP of 8 sounds good to me. So we could just go through the steps here. Once again, just follow the prompts and finish and exit. So now, just to show you, the patient is currently on AVAPS AE. They want to wean him to CPAP for a couple hours, see how he does. Just go into menu. Switch to secondary settings is already selected. You could select that. It prompts you to make sure. Switch to secondary settings, yes. And as you can see, patient is now in CPAP flex right here. Number 2, indicating that that's the secondary setting. Patient did okay, but is getting a little bit tired. Once again, we could just highlight. Switch to primary settings, yes. Patient is now back to AVAPS AE on a setting of 1. Once again, if you needed to go in and do a ventilator check, go to information, select, and you could just page down AVAPS AE, passive circuit, AVAPS rate 5. Let's talk a little bit about that AVAPS rate. This typically confuses, I would say, physicians more than respiratory therapists, but being that rate, people tend to think that it's a breath rate, but if you notice at the units, it's centimeters of water pressure. So what that means is this is a setting that can go anywhere from 0 to, well, 1 to 5. And what this will dictate is from 1 being an AVAPS AE rate, this will dictate of how quickly the ventilator will make adjustments to maintain the tidal volume set. So an AVAPS rate of 1 will be very slow adjustments. An AVAPS rate of 5 will be much quicker adjustments. So whether it's positional or so, if the patient turns on their back and the patient requires more pressures to get in the tidal volume, to get in the 200 millimeter tidal volume, the machine will adjust, increasing the pressure. Now, an AVAPS rate of 1, that will be 1 centimeter water pressure increase per minute to get the tidal volume to where it needs to. An AVAPS rate of 5 will be a 5 centimeter of water pressure increase in pressure to get to that to where that tidal volume will be. Also, just in case, if the tidal volume starts shooting over its set value, the 200 mLs, the AVAPS rate will also come down to maintain that tidal volume. And once again, the AVAPS rate will be just that. That'll be the speed at which the ventilator adjusts to keep that tidal volume, set tidal volume. Hopefully that makes sense. Do you want to take a break?